That may actually trigger their PTSD because their brain kind of puts them back into the state of that stressful response that was happening. All right, so today we are going to be doing a stellate ganglion block. Now, the stellate ganglion is a part of the sympathetic nervous system. So basically a connection between the brain and the rest of the body. Specifically, the stellate ganglion is found in the neck region, and that's where we'll be accessing for this procedure. What we're using this procedure for is actually to help kind of downregulate this connection between the brain and the adrenal glands in this kind of fight or flight response that some patients may have with PTSD, so whether it's fully diagnosed as PTSD or some form of traumatic experience that they've had, or just some patients who experience a lot of anxiety in general. And so what happens is, one example we can use is, wartime vets who have been involved in some form of explosion and now get triggered with hearing things like fireworks. And so what happens is the brain, the part of the brain that associates these sounds and images and sensations doesn't really have an understanding of past, present, and future, and it just knows that something is happening. And so someone who has PTSD may be, walking down the street and they may hear something fall or a firecracker go off, and that may actually trigger their PTSD because their brain kind of puts them back into the state of that stressful response that was happening. And so when that happens, the brain basically sends a signal which has to travel through the sympathetic chain, so the stellate ganglion has to travel from there down to the adrenal glands. The adrenal glands then secrete both epinephrine, so that's our adrenaline, and cortisol, because it's your brain's basically telling your body, hey, you need to be ready to do something because something stressful has just happened. And so that's priming you to be able to run away or do whatever you need to from a primal standpoint. And so then what happens is the adrenal glands, once they secrete that, those messengers, the epinephrine and cortisol, actually go back up to the brain, and it creates this kind of circled loop that basically confirms that, yes, this was a stressful response. Good job, brain, on protecting us, and we need to do something about it and ingrain this pattern further because that was a good thing, even though it really wasn't a good thing. And so what the stellate ganglion block is going to do is it actually dampens that connection between the brain and the adrenal glands. And so when some stressful event happens in a period of time after we do the stellate ganglion block, that connection down from the brain to the adrenal glands is not as strong, and so less adrenaline and less cortisol is released from the actual adrenal gland. And so the brain still registers, oh, something bad, but then it doesn't get that positive feedback loop from the adrenaline and the epinephrine because we've dampened that connection between the two. And so then the brain kind of goes, oh, that actually wasn't that bad. I didn't die. I didn't get shot at. I wasn't in a traumatic experience. And over time, with this kind of repetitive, dampening of the connection between the brain and the adrenal glands, you can help to retrain the brain to not be as triggered with these events. And so one of the most important things for people who are going through the stellate ganglion block is it's that you have to be in some form of psychotherapy, whether that's cognitive behavioral therapy, whether that's talk therapy, whether that's EMDR, basically anything that helps you to work through these situations, because we're using the stellate ganglion block as a way to allow a person to do the hard work of talking through their traumatic experience and working through that, so that way their brain becomes almost deconditioned or desensitized to what was happened or what has happened in the past. And so this, as a standalone therapy, is not overly effective long term for actually treating the cause of this PTSD and traumatic kind of experience that patients have, because it's just dampening the nervous system. And then that nervous system comes back online after a period of time, and it just goes right back up to where it was. The important thing is working through and actually having some form of re-exposure to those traumatic experiences. And again, that can be done through EMDR, talk therapy, CBT, or other forms of psychotherapy. So that way the brain has this opportunity to go, oh, that's not scary anymore, and I can handle this, and I can calm the brain down. And so that's kind of why we're doing the stellate ganglion block today, is to help a patient to work through some traumatic experiences that he's experienced, and help him to not be as triggered.